some of these facts and figures will kind of dispel some of the common fallacies on the street of what happens. Small percentage of physicians cause a larger chunk of claims. A high percentage of physicians are going to be sued or have an incident reported at least once during their career. So that's why this insurance is important, because it's just prevalent in the industry. The biggest point on this slide to make is this is how you determine why or if or should patients get money. Permanent injury. I'll give an example of laser hair removal. You get these laser machines. A man walks into a laser skin clinic, they have the hair removed from his back. Technician who may not be well trained turns up the machine really, really high so that there's too much heat. Puts like bacon scars on his back. That's a permanent scar. You scarred me. I want justice and I want some kind of remediation here. What are you going to do about it? Well, they sue, because there's permanent injury there. It's the same thing with surgery. It's the same thing with so if there's not permanent injury there, what case do you have? If there's permanent injury, you got a case because you're going to have damages that can be assessed in treating that permanent injury. The man with the scars on his back is going to need treatment. I mean, dermatology, whatever it takes to, make it better. You can then, therefore, associate a cost with that, right? And then you go to an attorney, and the attorney says it's going to be $100,000 to fix this problem. Insurance company's probably going to settle that because how are you going to? It's hard to defend that, as opposed to a case where there's no permanent injury. I mean, there was a suit where a patient in surgery was complaining that he was awake during the surgery, so the anesthesia didn't work. I was awake. I don't know how that could happen when you're cut open, but surgery went fine. Well, the case didn't go anywhere because there's no permanent injury there. The prognosis was fine. The physician really didn't do anything wrong. So a lot of those so-called frivolous cases kind of fall into that category. So it's the black and white of it. Is there permanent injury or no permanent injury? That's really how the courts are going to look at it. If there's somebody severely scarred or something that's permanent, the court's going to be sympathetic to that person, give them money. And that's where the settlement process goes in because, and again, the point right here is half of the suits are brought against surgeons. Obviously, surgery is a very high-risk specialty and, goes without saying, and that makes sense, right? And probably the bottom bullet point is things that surprise people. The insurance company, when it does adjudicate and go to court, where maybe the insurance company would say, hey, we're not going to settle this. We're going to take this to court. Well, they have a pretty good confidence that they're going to win. They actually win most of the time when it does go to court. So that's why a lot of times the plaintiffs want to settle, because they know if they go to court, the odds are going to be against them. The insurance company has more resources. They have cases, and again, getting back to this permanent injury. So a lot of times the plaintiff's attorneys will, a lot of people think, well, they want to go to court. They're going to haul the doctor up in front of a sympathetic jury and win big money in pain and suffering, and I think that's how they make their money. Actually, 90-something% of these things will just settle. The two lawyers will sit down in a room and just say, we're willing to do this, we're willing to do that. The insurance company might say, we'll settle this for $300,000. If the lawyer says no, and they want to go to court, the odds are going to be against them that they're going to win. But once it goes to court, that's when all the wild cards come out, because you never know what's going to happen. But historically and statistically, the insurance company wins most of the time. As I said, state regulated. Different states have different tort environments. I'm from Cook County, Illinois. In Chicago, which absolutely has to be the highest, what they refer to as the judicial hellhole, has the highest rates and the highest number of suits. That's the way it is, and there's just a lot of lawyers there. But you can see, if you're a plaintiff's attorney in Alaska, you're not making much money because they only filed 9 suits, as opposed to New York, it was 1,500. That's in 2011. So what happened is if you may recall, about 10 years ago, 10, 15 years ago, you saw these highly publicized cases of big pain and suffering judgments. $10 million, $20 million, $100 million pain and suffering. And what was happening was the insurance companies were like, we have no way we can price this. We're pulling out of the state. In Illinois, we had 46 companies, literally every company was writing medical malpractice. When Madison County, Illinois, put down a very big pain and suffering judgment of like $100 million, that was reduced to about 6. The insurance companies just left. They're like, there's no way we can make money in this state, so we're leaving. And what that did was it caused the remaining companies to raise the rates through the roof. Supply and demand type thing. And the doctors were complaining, and they were leaving the state. They're going over to Indiana, which had a patient's compensation fund, like a state-run malpractice department that controlled the rates. And they're, I had an obstetrician in Cook County who was paying over $300,000 a year for malpractice insurance. So again, the permanent injury is probably the solid point that you want to take from this. Now, when we're talking about anti-aging and aesthetics, these are really what we're seeing so far in terms of claims. You're not seeing, you're not delivering babies, you're not doing orthopedic surgery, but you see things like, burns with the lasers, misdiagnosis of certain things, allergic reactions, sexual misconduct issues, and the last one is lack of a reactionary plan. And so when I underwrite, help my underwriters write a doctor account, do you have, on the application, do you have hospital privileges? Well, a lot of the independent guys don't. Okay, so the question is, what happens if something extremely drastically goes wrong with an allergic reaction? You've got to get that patient to the hospital. How do you do that? It's what's called a reactionary plan. Well, if you just say, well, I'll just call 911, that doesn't look too good in court. So to have a plan to say, well, I have a friend of mine that could admit that person to the hospital. I have an arrangement with the hospital. Hospitals now have what they call hospital lists. And a hospital list specialty is to facilitate admission. One of the things they do is to facilitate admission of patients from doctors that don't have hospital privileges. So have a plan in case like the most extreme, most unlikely thing is going to happen that you're not aware of. And that's what a reactionary plan is. We actually had a case where the doctor, insurance company paid out because the doctor called, something happened, we'll just call 911. So you make it look like you just pushed that patient out of your door and said, you're on your own at this point.